Chairman. I appreciate it. I think Mr. Lamborn mentioned about the physicians, what have you, and one of you testified with regard to medical scribes. Why don't we have medical scribes available to all our VA physicians? I hear from my veterans, and they say that the doctor really wants to treat them, and they still have to scribe, and it takes so much time away from the patient.
Congressman, I think as you're suggesting, the issue of taking physician time away to spend on doing entry into a medical record is a problem. It's a problem in VA. It's a problem throughout the healthcare industry. We are seeing practices, particularly in the private sector, of using scribes, something that I'm very familiar with. And we actually are beginning in different areas of the VA to begin to take a look at this as an option. I think it is a viable option that we're exploring. It's obviously an expensive option, and given the size of VA, we're taking a hard look at that because using resources appropriately is certainly very important to us. But it is an area that we are trying to lessen the time that physicians are spent entering information into records and more time with their patients. And the scribe system is certainly one of those avenues we're looking at.
As David says, we're testing, we're piloting the scribe. The flip side of the argument, just so everybody understands both sides, is if we simplify the medical record enough so that the alerts that come up really help the doctor, and you want the doctor interfacing with that record to see those alerts rather than a scribe who may not be sufficiently medically trained to understand what those alerts do. So we have to work both sides of the equation.
Thank you. In your testimony, Mr. Secretary, you mentioned that this independent assessment reinforced the VA's own analysis. Has there been have you done an independent, has the VA done an independent assessment of their own?
Well, we have. In fact, in my first few weeks in position, I traveled to as many facilities as possible. I've now been to over 220 facilities, and that has fed the information into our transformation plan. I shared it with the chairman within my first couple of weeks. You might recall it was a high-performance organization model. I shared it with the President of the United States, and that's what led to the 90-day plan called the Road to Veterans Day, and also to the My VA transformation and the 5 strategies of My VA.
Would you be willing to share it with us and
sure,
public
absolutely.
as well?
It's only 2 pages long. It's not 4,000 pages, and it didn't cost $68 million.
Okay, well, I appreciate us taking a look at it. We really would. I think we get a lot out of that. Was there anything that VA's assessment discovered that was not included in the independent assessment?
I think what I would argue is my assessment was more about leadership and culture. It became very clear to me that I needed a new leadership team. Jim Collins, who's a friend of mine, likes to say you got to get the right people on the bus and get them in the right seats on the bus. The assessment talked a lot about leadership, but very specifically, I needed a new leadership team. Secondly, I spent a lot more time about the culture. What do I need to change the culture? I called out 2 things. One called design thinking. Design thinking is a technique that's used to design delightful consumer experiences, and I can go into more detail of the training that we did 2 weeks ago, or a week ago, on that. Secondly, Lean Six Sigma and training Lean Six Sigma. Think about design thinking as the way you design the experience for the consumer. Think about Lean Six Sigma as the way you improve productivity of what's backstage, what the consumer doesn't see.
Thank you. Last question. VA's presentation to the Commission on Care 2 weeks ago stated that VHA has begun to work on many of the 188 recommendations that were included in the assessment, the independent assessment. Which of the assessment's many recommendations have you been working on and prioritized? If you can give me some specific examples.
Congressman, I'd be glad to do that. I think that in addition to what the Secretary said, VHA has also had its own strategic plan called the Blueprint for Excellence. That was created after the Phoenix crisis, and Dr. Jonathan Perlin came in for a period of time to help with VHA to create its own strategic plan. So we have been hard at work in many of these areas that actually fit very nicely, align with the recommendations that were identified in the independent assessment. They have to deal with these exact issues, how we prioritize our data, how we essentially address our leadership issues, how we engage our staff and improve morale and improve our hiring practices, how we ensure consistency and best practices across the system, something that both Mr. Byrne and Dr. Guar identified today. So these are all issues that VHA is hard at work at. I didn't say that we've done all 188, but that we have begun work on the vast majority of these, and we're going to use this independent assessment and what comes out of the Commission on Care to make sure that we're refining those appropriately.
Thank you very much. I yield back, Mr.
Thank you very much.